8:12 in the morning. It is Indiana in the morning, and it's WCCS 101.1 FM, AM 1160, and WCCSradio.com. We get to talking off mic here, and I always forget to do what I'm supposed to be doing here. I blame you, Seth.
Oh, sorry about that.
Just kidding. It is the voice of Indiana County, WCCS 101.1 FM, AM 1160, WCCSradio.com. Seth Worthing is with us this morning. As Seth explains it, he usually sees you when you're asleep. So you don't even know he's in the room working with you. Our conversation brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. And injured people, really, I guess, is a lot of what you do, working with orthopedics operations there at IRMC.
Absolutely. I'm a physician assistant, a PA, with the orthopedic team over at Indiana Regional. So, yes, I do see you primarily when you're asleep. I'm usually coming into the room, the OR, after you've already been put under anesthesia to help get things moving and assist in the surgery, and then get you all comfortable, move back over, and back to PACU, or the post-anesthesia care unit, just to make sure that you're taken care of and streamline all that process.
So you work with some of the surgeons in COSM and other areas within IRMC family?
Just the surgeons with COSM. I work in the orthopedic surgery department.
Yeah. Okay.
So that's just Dr. McCurgan, Dr. Wilson, Dr. Bazowski, and Dr. Trail at the moment here at Indiana Regional.
Okay. All right. So I want to talk to you about a number of different things, because I've been a frequent user of their services, as I was explaining to you, because I'm a klutz and I'm always breaking things. But when we think about orthopedic surgery, and it's interesting that when I mention a knee surgery that I might have had, automatically people assume, well, that's a knee replacement.
Yes.
Doesn't have to be, though, does it?
No. The orthopedic realm is just unbelievably vast. I mean, we're talking going from head to toe, essentially. I've worked in all the specialties, the subspecialties of orthopedic surgery, doing cervical spines down to foot and ankle. We have our hand specialists, shoulder specialists. You have your sports medicine specialists that you see typically working on our athletes. And then you have our total joint specialists or our trauma specialists as well.
Yeah.
It's really vast. Luckily at Indiana, we pretty much cover all of that minus the spine portion.
So there's a lot of different areas you can get into when you're talking about orthopedics.
Oh, absolutely.
And when you talk about orthopedic surgery at IRMC, how long have you been doing robotic surgeries at IRMC? Because it's a game changer, isn't it?
It is a game changer. At IRMC, we obtained the Stryker Mako robot sometime prior to COVID, prior to 2020, but really didn't start kicking in as COVID was kind of, well, it's still here, but kind of wrapping up as everything kind of slowed back down.
Yeah.
I believe the Stryker Mako launched its first robotic total knee system, I think 2016. I started diving into robotics in 2018 when I was practicing in Washington, D.C., and have since continue that up here.
Yeah.
And there are a few different robots on market right now. The big ones are the Stryker Mako, which is what we have here at IRMC, and that's probably the one you're going to see most commonly across the U.S. Apart from that, we're going to see the Zimmer Biomet Rosa, and then Smith & Nephew has their Corey. All different acronyms.
With the Mako, I'm sure that you were amazed at what it could do when it first came out. Now you've been working for quite a while. And actually IRMC just passed a milestone with the Mako surgery unit, didn't they?
We did. We just hit our 500th Mako surgery, it's a great milestone for us because it's showing that now we've been doing a tremendous amount and we're very competent in using this robot. When the robots first came out, it was amazing to see how much control you have over that total knee. And we have really been working on total knees for a number of years, and they've come a tremendous way.
Yeah.
I mean, when we first started doing total knees, we thought they were just a hinge system, just a hinged joint. And then we started realizing, there's a rotational component to it, and the knee's more dynamic than what we initially thought. Now that we brought the robot in, we're able to fine tune it, and the potential of a great knee has just just skyrocketed since it came out. When I say that, we're playing with the position of the prosthesis, or that part that we're putting in you. We're playing by the millimeter and by half a degree at a time across multiple planes. It's really incredible at what we sit down there and do, and we can look at under live values in the operating room.
But, without getting so technical, because
It's
obviously we don't understand that,
Yeah.
but the Mako is one thing, but the actual joint that you're putting in is another thing.
another.
And those things advance too, don't
Yes,
they?
absolutely. They have advanced tremendously over the years. One of the big advancements that we saw was coming out with different sizes in terms of when they started, we just had a few sizes to a total joint, but now we can pretty much match a joint to your knee pretty well based off the size. And now some of the companies are coming out with custom prostheses,
Amazing.
custom joints.
All right, so you've got total knee replacement. There's also partial joint replacement as well. I'm expanding beyond just knees, but other joints within your body too. There's partial.
Yes.
What calls for partial over total?
We'll start with
Specific damage.
specific damage, and that's typically what you see in the knee. In your knee, you have 3 compartments. So we can change one of those compartments if necessary. Now, the indications for those, or the reason we would do those, is a little more slim than getting towards a total joint. But normally it's significant osteoarthritis, significant wear in that single compartment. Sometimes there's an injury that results in that. When it comes to a hip and doing a partial replacement in a hip, usually it's due to a fracture.
What would make someone, because somebody having a knee problem, somebody having a hip problem, or something like that, what would be the indication for them that a replacement of some sort, partial or full, is indicated? And what would they say? This hurts, I need to go to the doctor, is probably what they generally say. And then that starts a process, doesn't it?
Yes, definitely starts a process. And once something starts bothering you consistently, I usually recommend, come on in, let's get it evaluated, and we can address it there. Like I said, it's specifically when we see the knee, it's when one compartment of the 3 is significantly worn. Like I said, oftentimes it's with an injury. It may have been an old sports injury that you had in high school, and now, I've always had this bum knee, and now 20 years down the road, 30 years down the road, you say, hey, you know what, this is really, really starting to bug me. Let's get it looked at, and then
Wear and tear.
yeah, essentially, most of the time we're going to see wear and tear.
Yeah.
And unfortunately, wear gets worse with time, and as time goes on, it gets worse and worse and worse and worse, and to a higher and higher degree.
Now, we're talking surgeries, but there are other things that you can do to help somebody with their knee pain, their hip pain, whatever joint it happens to be. And injections are a big part of this too, aren't they?
Absolutely, absolutely. I like to push off surgery to the last point. I'm a big fan of what we would call joint preservation, making sure that we maintain your joint, either preoperatively and postoperatively. Now, there are various types of injections that we use in orthopedics that could be used depending on the severity of the disease, of the osteoarthritis, or the injury that you had. We're doing injections where we take your own blood, we spin it down to what we call platelet-rich plasma, and re-inject it to try to get your body to heal itself. We're also using our typical steroid injections that we use to go in there, kind of cut down on some of the inflammation that's built up in the knee and give you some pain relief as well. And oftentimes we will try those as measures prior to going towards surgery.
It is the voice of Indiana County WCCS. We're talking to Seth Worthing, who is a PA working with IRMC Orthopedics. And surgeries nowadays, as opposed to even 5 years ago, 10 years ago, obviously the recovery time with the Mako unit is so much better, isn't it?
Yes, and that's what we're seeing in terms of anecdotally, talking to physical therapists, talking to our patients, talking to other physicians that are using the robot. We're noticing that there is a much quicker recovery in terms of when you're getting back to driving, when you're getting back to work, when you're walking without an assist like a cane or a walker. We're seeing that over 90% of patients are back to work, back to driving, back to walking without an aid within 3 months of surgery, which is phenomenal.
Yeah.
Compared to a standard knee, we don't have that much data at this point yet. That's just because we haven't been doing these surgeries long enough and collecting a large enough data pool to do a fair comparison.
Yeah.
But anecdotally, it seems like we're doing much better.
Yeah, and that's terrific news, and that just talks about the advances that are available now that weren't in the past. When somebody is, say, getting to their late 40s, early 50s, and the pain from years of exercise, whatever it happens, tennis, running, especially running on hard surfaces and everything, when it starts to get to that point where they're going to have to do something, a lot of folks will say, if I do that, if I go in and I get surgery to replace a joint, that's the end. I'm never going to run again. I'm never going to play tennis again. I'm never going to do my things that I like to do again. Not the case.
No, not the case. That was more of the thought years ago because we were really worried about how long that prosthesis would last. Well, the technology in terms of the materials that we're using, especially the plastic in there, has gotten so much better that we expect that when we do a total knee replacement for you or a total hip, that's going to last you the rest of your life.
Wow.
A lot of it is going to be kind of transitioning activities, maybe getting away from our higher impact activities. We've done lots of studies on looking at what occurs in the knee and the forces there to determine, hey, you know what? Yes, cycling, swimming, even just walking at a slightly slower pace will decrease the forces through your joints, and they'll make that joint last a lot longer. Now, doing significant jumping or other high impact activities isn't always recommended, but the knee is going to hold on and handle it for some time for you.
It is pretty amazing to me when you read the numbers, and one of the docs at Cosm was telling this to me once, the amount of force that you put on your joint with a simple running step is so much more than you could possibly imagine. And your joints have to put up with that all the time, especially if you are an athlete.
Absolutely. When we're talking about just walking at about a 4 mile per hour pace, so kind of a brisk walk, you're putting almost 4 times your body weight through your knee in terms of force. And we determined this through various calculations, looking at your anatomy. And then also a couple institutions have put in what's called smart joints, where they actually have sensors in the total joints that they put in to take that measurement as well. And they did comparative studies to see what activities lead to a lot of higher pressures in the knee, and what we would call contact force on the knee surface. One of the best things that we notice now is rowing. Working on a rowing machine really takes off. You're putting actually less than your body weight through your knee when you're rowing. It's about 0.9% of your body weight.
Wow.
Goes through your knee when you're on the rowing machine. So if somebody's having knee pain, often they'll recommend, hey, let's go to the cycle, let's go to the rowing machine, let's get in the pool and start swimming. Take that pressure off that knee so you can stay active. And that's a big point to one of my recommendations when we talk about, hey, I'm looking at a total joint replacement. I want you to stay active as possible. I mean, movement's life. Stagnation's death. I want to keep you moving as much as you can up to your total joint replacement, because afterwards, you're going to do much better with it.
Tell you what, I got to go down and get that 1980s rowing machine fired up again, don't I? Seth, it's been great meeting you. Seth Worthing. And if folks want to learn more, obviously, most trips are going to begin with a trip to your primary care physician. But they could begin right with IRMC Orthopedics and get that painful joint taken care of.
Absolutely. Coming right into our Human Motion Institute and making sure that we can take care of you from the get-go and make sure that we have everything in line, and then we can kind of streamline the process for you.
Well, we could go on for hours with this conversation. I have to do the CBS Sports, though, and we got news and other things. Seth Worthing, thanks so much for the visit. We appreciate it. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com.